Medication errors are a serious public health concern worldwide. These errors can occur at any stage, from prescription to administration. The consequences can be devastating, leading to prolonged hospital stays, increased healthcare costs, and even death. It's a problem that demands our attention, urging us to find better, safer ways to administer medication. The World Health Organization estimates that medication errors harm millions of patients and cost billions of dollars annually. These errors are not just statistics, they represent very real risks to patients everywhere. Each error represents a potential tragedy, a situation where preventable harm could befall someone under medical care. Children, especially infants in neonatal intensive care units, are particularly susceptible to medication errors. Their small bodies and developing organs make them more vulnerable to the harmful effects of incorrect dosages. A tiny miscalculation, a slight deviation from the intended dose, can have amplified consequences for these young patients. Infants in the NICU often require multiple medications, each with its own set of dosage calculations based on weight and age. This complexity increases the risk of errors. Furthermore, the lack of standardized concentrations for pediatric IV medications exacerbates the problem, turning what should be a routine procedure into a high-stakes calculation. Several factors contribute to medication errors, particularly in busy healthcare settings. Heavy workloads and staff shortages can lead to fatigue and burnout, increasing the likelihood of mistakes. Imagine a healthcare professional working a double shift, their mind exhausted after hours of critical decisions. In such situations, even a simple calculation can become prone to error. The absence of clear standardized guidelines for medication concentrations further complicates the issue. When different hospitals or even different units within the same hospital use varying concentrations for the same medication, the potential for confusion and error multiplies. It's like trying to navigate a city where every street sign is written in a different language. Section 4, a call for clarity, AHP and ISMP's recommendations. Recognizing these challenges, leading healthcare organizations like the American Society of Health System Pharmacists and the Institute for Safe Medication Practices have advocated for standardizing IV medication concentrations. Their recommendations emphasize the need for clear, consistent guidelines to reduce confusion and minimize the risk of errors. Standardization means establishing uniform concentrations for commonly used IV medications across all healthcare facilities. This uniformity simplifies dosage calculations, reduces the potential for misinterpretation, and provides a safety net for healthcare providers. It's about creating a system where everyone is speaking the same language, using the same units of measurement, and following the same rules. Section 5. Saudi Arabia takes charge. A new era of standardized care. Saudi Arabia has embarked on a commendable journey to enhance patient safety by implementing standardized concentrations for IV medications. This initiative reflects a proactive approach to tackling a global healthcare challenge and sets a positive example for other nations to follow. By taking concrete steps to minimize the risks associated with medication errors, Saudi Arabia is demonstrating its commitment to providing the highest standard of care to its citizens. This nationwide effort involves a comprehensive review of commonly used IV medications, including antibiotics and cardiovascular drugs. The goal is to establish uniform concentrations that will be adopted by hospitals and healthcare facilities across the country. This standardization will simplify medication preparation and administration, reducing the cognitive load on healthcare professionals and minimizing the potential for errors. Section 6. A Safer Tomorrow, the Promise of Standardization. The implementation of standardized IV medication concentrations holds the promise of a safer healthcare environment for all, especially for the most vulnerable patients. By simplifying procedures, reducing confusion, and minimizing the potential for errors, standardization has the power to transform medication safety. This initiative, however, is not a finish line, but rather a starting point. It requires ongoing monitoring, evaluation, and continuous improvement to ensure its long-term success. The journey towards a completely error-free healthcare system is ongoing, but with each step towards standardization, we move closer to that goal. For more information, you can review the series and collection of standardized parental medication published on International Journal of Pharmacology and Clinical Sciences, 2020.